Hello and welcome to Chapter 7 in Computers and Healthcare. We are talking about the Administrative Information Systems. We're going to start on page 109 in the textbook. So again, we're going to go through this chapter briefly, so be sure to read the entire chapter about each one of these information systems. We're going to cover, I believe, 9 of these systems. All right, so overall, administrative information systems manage the business of healthcare, and they were the first information systems to be used in healthcare. The data collected in administrative information systems are mainly financial or business-oriented in nature, rather than clinical. The administrative information systems perform many tasks throughout the healthcare organizations. The main administrative information systems are summarized in the following list, and we're going to discuss each of these individually. So our first information system is the financial information system. It monitors and controls the financial aspects of the healthcare facility. Then we have our human resources information system. It tracks and manages all employees and other contracted personnel within the organization. Then we have our decision support systems. It gathers data from a variety of sources to assist management and staff in decision-making tasks associated with the non-routine and non-repetitive problems. Then we have our Master Patient Index. It provides a permanent record of patients treated at the healthcare facility. Next, we have our Patient Registration System, and it collects information on patients receiving treatment. Then we have our Scheduling System. It allows the facility to make efficient use of resources such as operating rooms. The Practice Management System combines a number of applications required to manage a physician practice. The Materials Management System manages the supplies and equipment within a facility. And the Facilities Management System allows the physical plant operations to control the automated systems within the facility for patient safety and comfort. So that's talking about our heating and air systems, automated key control, and preventative maintenance such as testing fire extinguishers, elevator inspections, and the care of various equipment used in the healthcare facility. All right, so let's pick up with our first system. We're going to talk about our financial information system. This system is critical to the physical health of the healthcare facility. The healthcare facility must receive accurate financial information in a timely manner to monitor and manage the finances of the healthcare facility. This information can be used to plan and control the expenses of the day-to-day operations as well as long-term investments. The management of the accounts receivable and the accounts payable on a daily basis by the healthcare facility is known as revenue cycle management. The revenue cycle is a very complex process involving several departments and many employees who perform tasks of reviewing services provided for claims submitted, as well as reviewing outstanding claims, returned claims, denials, missing accounts, bill holds, and other claims involved in the revenue of the healthcare facility. Many health information management professionals are involved in working with the revenue cycle in their facilities, and some work for vendors who specialize in the area of revenue cycle management and cleanup as a business. The financial information system includes functions related to patient accounting, accounts receivable, accounts payable, the general ledger, investment management, contract management, payroll, and billing and management claims. The patient accounting module collects all of the charges related to patient care. Some charges, such as the patient's room charge, are automatically generated, but others are created when nurses, respiratory therapists, and other staff enter charge information either through the financial information system or through a clinical information system that captures the information automatically and then shares it with the patient accounting system. These charges come from the charge master. The charge master is a financial management form or software that contains information about the healthcare facility's charges for its services it provides to patients. It can also be called the charge description master or the CDM. Over on 111, the charge master has such an impact on healthcare facility, periodic updates are required. The classification system codes must be updated annually, and HIM professionals must ensure that their respective chargemaster updates are completed annually by the Healthcare Facilities Information Services Department when the software updates are received. Otherwise, charges billed can mean a loss of revenue to the healthcare facility. Once the updates are performed on schedule, the healthcare facility is reimbursed the amount they are owed based on their particular geographic region of the country. Moving over to 112, we're going to talk about the impact on HIM. The coding professional staff will populate the diagnosis and procedure codes either through direct data entry or from an interface to an encoder. HIM and coding staff have always played an integral part of the financial viability of the healthcare facility. This is particularly true with the completed transition to ICD-10-CM and ICD-10-PCS. Extensive and continuous training is required to maintain optimal skill in identifying the correct and appropriate diagnostic and procedural codes. With the massive increase in the number of codes due to increased specificity in ICD-10, coders must be thoroughly trained in anatomy and pathophysiology to assign the precise codes. However, codes can only be as accurate as the documentation allows. Clinical documentation improvement is the process an organization undertakes that will improve clinical specificity and documentation that will allow coding professionals to assign more concise disease and procedural classification codes. The quality of this documentation is vital in order to properly evaluate patient care, meet all regulatory requirements, and obtain the appropriate amount of reimbursement. Because quality documentation, whether it be paper or electronic, is one of the cornerstones of the HIM profession. It is essential for the HIM and coding staff to be integral in all phases of CDI. All right, so we're going to move on down to our human resources system. And get a little bit into it. Now, while HIM does not use the human resources information system, it does use some reports generated. So we're going to get into what's included in this system. So a healthcare facility requires many staff members in order to operate. Many healthcare facilities operate 24 hours a day, 7 days a week. Because of staffing requirements, payroll expenses make up a large part of the operating budget. This large outlay of cash demands strong management of the Human Resources Department within the organization. The Human Resources Information System tracks employees within the organization. This tracking includes promotions, transfers, terminations, performance appraisal due dates, and absenteeism. The individual data elements collected include the employee name, the employee number, department, title, salary, benefit information, hire date, results of performance appraisal, previous titles, termination date, certifications, disciplinary actions, and eligibility for rehire. These elements and other data are used to create a permanent record for the healthcare facility. Dropping down on page 113 about Midway, reporting is an important part of the Human Resources Information System. Reporting features can be used to track items such as turnover rate, open positions, labor cost, benefits, budget, or overtime. The healthcare facility may also track employee satisfaction and report on the findings of the surveys. Many facilities offer in-house educational opportunities to employees, and attendance at these events is tracked within the HRIS software. These might include optional educational seminars to advance managers with training and development skills. Other workshops might include cardiopulmonary resuscitation, or your CPR classes for all staff, and it may also track mandated classes for all employees that require annual attendance, such as fire and safety classes, OSHA standards, and privacy and security training. Department directors can then easily use the reporting function to assess the attendance within their own departments, as well as results of these educational classes by their employees annually. And so while I said the HIM department don't use the HRIS directly, the director can use it to generate reports for these specific classes that are required. For example, North Mississippi Medical Center has a yearly customer service training called CARES, and you can go into their systems and you can see which one of your employees attended the CARE sessions. And you can also review applications if you have open positions. They will send you those. And then, of course, you can perform other tasks related to the HIM department. All right, moving over to 114, picking up with decision support systems. The DSS, as defined earlier, is an information system that gathers data from a variety of sources and assists in providing structure to the data by using various analytical models and visual tools in order to facilitate and improve the ultimate outcome and decision-making task associated with the non-routine and non-repetitive problems. It is also used to solve structured problems. This means that the decision support system is not used to schedule staff, determine inventory levels, or perform other routine decisions, but rather to make decisions about whether to open a new women's health center or a geriatric center. Other decisions that may be candidates for the DSS are whether or not to add new examination rooms in the emergency department or to open new operating rooms. All right, so let's talk about a couple of different types of decision support systems. We have our executive information system, and this is a type of decision support system that is designed to be used by healthcare administrators. As such, it must be easy to use and have access to a wide range of data. It could have internal data and external data. With your executive information system, a lot of graphs and charts are generally used as part of the results. Advantages of the EIS include improved competitiveness of the healthcare facility, knowledge of how the healthcare facility works, making information available to authorized users throughout the healthcare facility, and assistance in making strategic decisions about the healthcare facility. A dashboard report gives administration structured information to make intelligent decisions for the future. In this example, an administration can view the dashboard report and see from the diagnostic-related groups and the length of stay what the facility was actually reimbursed and what it actually cost the facility to treat the patients. The last column gives administration an idea of the profit that was expected versus the actual profit. This type of report is useful to administration in planning for the future to make decisions. And we have an example of a dashboard on page 115 in figure 7.2. All right, moving on to Master Patient Index. The Master Patient Index is part of the hospital information system. It's a patient identifying directory referencing all patients related to a healthcare facility that also serves as a link to the patient health record or information, facilitates patient identification, and assists in maintaining a longitudinal record from birth to death. The MPI identifies every patient who has been admitted to the healthcare facility, and it is key to locating all patients' health records. The MPI has to be kept permanently because that's mandated by some legal statutes. And it includes information, both demographic data and visit-specific information. Demographic information will include data such as patient name, and the visit information will include items such as discharge date. Data contained in the MPI include internal patient identification, so that's going to be their health record number, patient's name, their date of birth, their gender, race, ethnicity, address, telephone number, alias, previous or maiden names, social security number, universal patient identifier, which is not yet established, encounter visit number, admission, encounter or visit date, discharge or departure date, encounter or service type, encounter or service location, encounter primary physician, and the patient disposition. So dropping down to functionality. Information about patients can generally be retrieved using many of the previously mentioned data elements. The most commonly used are patient name and health record number. The NPI usually has Soundex capabilities, which allow the user to retrieve patients based on the sound of a name. Soundex is a phonetic-based indexing system that is easily incorporated into computer software for searching surnames that sound alike but are spelled differently. The Soundex search is useful when there are multiple ways to spell a last name, such as Burger. And you can see the different spellings of Burger. There's 4 of them on page 116. There are times when a patient is issued one or more duplicate health record numbers. When the duplication is identified, the NPI must have the capability to combine these health records under one health record number and keep a record of the health record number eliminated. The NPI must also be able to address overlays. Overlays occur when 2 patients are assigned the same health record number because of the incorrect assumption that they were the same patient. Duplicate health record numbers and overlays cause problems with data quality and ultimately can create quality of care risks because either the patient's information is fragmented or 2 patients' records are intertwined. And then we have our Enterprise Master Patient Index. In integrated delivery systems, they typically have an Enterprise Master Patient Index, which provides access to multiple repositories of information from overlapping patient populations that are maintained in separate information systems and databases. An IDS is an organizational arrangement of a network of health providers that may include hospitals, physicians, and health maintenance organizations that provide coordinated services along the continuum of care for ambulatory, acute, and long-term care and may extend across a geographical region. An EMPI allows all of the components of the IDS to share information about that patient. The health record number assigned may be the same for all hospitals, ambulatory settings, and other components of the healthcare system. And it provides access to multiple repositories of information from overlapping patient populations that are maintained in separate information systems and databases throughout the related network of IDSs. So the HIM department is a key user of the NPI. The HIM staff is responsible for the data quality of the NPI, so they perform the various tasks to maintain quality, such as combining duplicate health records and correcting overlays, along with other data quality issues. The HIM staff also uses the NPI to look up health record numbers, identify discharge dates, confirm that health records contain all patient visits, look up when the patient was last seen in the healthcare facility, merge duplicate health record numbers, correct errors in data entry, and unmerge overlays when one patient's record is overwritten by another patient record. These records must then be separated into their original files. All right, our next system is the patient registration system, and it's usually called registration, admission, discharge, transfer, so we will call it RADT. Patient registration systems are frequently known as RADT. The RADT is defined as a type of administrative information system that stores demographic information and performs functionality related to registration, admission, discharge, and transfer of patients within the organization. The information collected in the RADT is transferred to other information systems. The transfer of data ensures that the demographic information is consistent and prevents data from being entered over and over again. If the patient needs multiple tests or services performed on the same day, such as lab, physical therapy, and x-ray, the registration system should be able to schedule all of these tests with one phone call. The RADT system issues the health record number assignment to the patient folder. All right, and then we have different reports that can be generated. Some of these are the daily admission list, the discharge list, census report, transfer list, and bed utilization reports. The facility may also generate monthly, quarterly, yearly, and ad hoc reports to show types of patients treated, number of discharges, number of admissions, occupancy rates, and other information needed. The RADT system may also print out routine documents such as general consent form, notice of privacy practices acknowledgement, and advance directives that the patient needs to sign. Although the HIM department generally does not register patients, the HIM department utilizes the reports that come from the REDT. For example, the discharge list is often used to confirm that all discharged health records arrived in the HIM department after discharge. Scheduling systems are used to control, and we're moving on to scheduling systems. The bottom of 118, they're used to control the use of resources throughout the healthcare facility. These resources can include staff, equipment, rooms, and more. Scheduling systems may be centralized or independent. Centralized scheduling allows the scheduling of all services of the healthcare facility so that one call can make multiple appointments. The decentralized system utilizes the scheduling feature of individual systems in use in each department, so calls would have to be made to more than one location to schedule multiple tests. And typically the HIM department does not use the scheduling system. All right, moving on to practice management. So this system is used by physician practices. Scheduling, patient accounting, patient collections, claim submission, appointment scheduling, human resources, and other functions are all built into this single information system. The practice management system may be fully functional information systems, or the physician practices can select from a variety of modules as needed by the practice. The practice management system can automate prescription renewals and other routine tasks. The practice management system may also connect to administrative information systems at the healthcare facility. One of the major functions of the practice management systems is billing. The practice management system will capture the necessary data, review the claim to determine if all necessary data are available, and then submit the data either to the insurance company or to a healthcare clearinghouse. The practice management system is able to generate reports. Sample reports include number of patients, profit or loss, most common services, and much more. The HIM professional who works in the physician office manager role will utilize the practice management information system in many of the same ways as the financial information system, master patient index, and other administrative systems. These tasks include charge master management, entering codes for billing, reporting, and tracking patient visits. All right, and then we're moving on to our materials management system. Healthcare facilities must manage a large amount of equipment and supplies. The typical materials management systems automates the purchasing process, inventory control, menu planning, and food service. Dropping down to functionality on 120. The materials management system can create requisitions, which use workflow in order to gain the necessary approvals for the purchases. Part of the process can be compared to the purchase to the budget to ensure that the necessary funds are available. This functionality helps control cost in the healthcare facility. The materials management system can be set up to automatically order supplies and equipment based on predetermined thresholds for inventory supplies, allowing for just-in-time inventory controls. For example, if the healthcare facility wants to keep at least 200 suture kits in stock, the materials management system automatically triggers an order for suture kits with the preferred vendor when the inventory drops to 250 suture kits. The materials management system can notify the financial information system when the supplies arrive so that the vendor can be paid, thus increasing the efficiency of the healthcare facility. The materials management system can generate barcodes to be applied towards supplies to be used and to charge the patient correctly. The use of the materials management system includes cost savings through improved efficiencies, better knowledge of the supplies in stock, reductions in the amount of supplies retained in inventory, and reduced loss charges. The dietary component of the materials management system tracks the dietary needs of the patient, the healthcare facility's food inventory, and food cost. A number of menus can be entered into the information system from which the dietary management and dietitians can work. The materials management system should have a variety of menus available from which to choose. The HIM department is not a frequent user of the materials management system. However, purchase requisitions may be used to order office supplies and other supplies for HIM departments. This is dependent on the setup of the materials management and ordering system of each healthcare facility. And moving on to our last system, our facilities management system. The physical plant will require maintenance and upgrades over the years. The physical plant refers to the building structure, surrounding grounds, parking lots or decks, and various building equipment such as elevators. A facility management system is used by a healthcare facility to manage the physical plant. A facilities management system will track routine maintenance such as elevator inspections, fire extinguisher inspections, and equipment preventative maintenance. Preventative maintenance will enable the equipment to last longer, so tasks such as filter changes, inspection of electrical cables, and other tasks will save the healthcare facility money. The facilities management software can control various features of the healthcare facility, such as the thermostat, automatic locks, and key cards. For example, the temperature provided by the air conditioner and heating systems can be controlled, making the healthcare facility more energy efficient. Doors can be locked and unlocked automatically at a pre-scheduled time, and employees can be given access or denied access to restricted areas. So let's go look at the impact on HIM. The HIM department is not a direct user of the Facilities Management Information System. Indirectly, the HIM department may use key cards for entry into locked areas or doorways, or use the automated HVAC system. The HVAC system is set by the physical plant staff, usually in zones for larger buildings, to run at set temperatures during various seasons to make operating cost of heating and cooling more economical. Alright, so that's going to finish us up in chapter 7. So again, be sure to read that entire chapter, get to know each one of those systems. There will be a lot of matching on the test, so be able to identify those systems by some of the characteristics described in the book. Happy reading and happy studying.